Hello everyone. So today in this video we are going to talk about four very important bacteria. Uh, those are the gram-negative bacteria. Those are Hemophilus influenzae, Acinetobacter baumannii, Bordetella Pertussis, and Brucella. So these are the four gram-negative organisms that we are going to talk in detail. So first of all, let us talk about Hemophilus influenzae. So the Hemophilus influenzae is gram-negative rod. It is also the cocobacillary rod, and the transmission of the Hemophilus influenzae occur by the aerosols. So it is aerosol transmission. Mainly the Hemophilus influenzae causes the mucosal infection. So the mucosal infection of the Hemophilus influenzae is caused by the encapsulated strands of the Hemophilus influenzae. So those mucosal infection could be the otitis media, conjunctivitis, and bronchitis. The Hemophilus influenzae produces the immunoglobulin A protease. So how do we culture the Hemophilus influenzae? The Hemophilus influenzae is cultured on the chocolate agar, because the Hemophilus influenzae needs factor 5 and factor 10 for its growth. The factor 5 is NAD plus, nicotinamide adenine dinucleotide, and factor X, which is the hematine. So this both factor 5 and factor 10, factor X, is available in the chocolate agar. The Hemophilus influenzae can also be cultured with Staphylococcus aureus, because the Staphylococcus aureus provides factor 5 via the RBC hemolysis. So after the hemolysis is done by the Staphylococcus aureus, it releases the factor 5. So it can also be co-cultured with the Staphylococcus aureus. The various diseases that are caused by the Hemophilus influenzae are epiglottitis. So you can see in this picture is also that the epiglottitis is seen. So the endoscopic appearance of this epiglottis is cherry red appearance. So it is the inflamed epiglottis. So you can see in this picture also the endoscopic appearance of the epiglottis, which is inflamed, which is cherry red appearance is seen. And in the lateral x-ray of the neck, you can see the thumb sign. You can see in this picture also, in the lateral x-ray of the cervical spine, or we can say neck, you can see the thumb sign in the picture. So the various other diseases that are caused by the Hemophilus influenzae are meningitis and pneumonia. Hemophilus pneumoniae and Hemophilus meningitis also it can occur. So let us talk about the Hemophilus influenzae vaccine. The Hemophilus influenzae vaccine is capsular type B polysaccharide vaccine. So it is the polyribosyl ribitol phosphate vaccine. The Hemophilus influenzae vaccine is conjugated to diphtheria, toxoid, or other protein, and it is given between the age of 2 to 18 months of age. So but it is only for the prevention of the Hemophilus influenzae. What happens if there is active infection occur? We give the antibiotics. We can give the amoxiclav. This amoxiclav means amoxicillin with combination of clavulanic acid is given for the various mucosal infection. And ceftriaxone is given for the meningitis, and rifampin can be given for the prophylaxis for close contacts. So this is all of Hemophilus influenzae. Now let us discuss about the Acinetobacter baumannii. So this Acinetobacter baumannii is gram-negative, aerobic, oxidase-negative cocobacilli. Again I am going to tell. Acinetobacter baumannii is gram-negative, aerobic, oxidase-negative cocobacilli, and it is commensal opportunist. The increased amount of the hospital acquired infection is caused by the Acinetobacter baumannii, especially in the hospital ICUs. So if the hospital ICUs or the hospital wards are not fully cleaned, not proper hygiene is maintained, then there can be the infection of the Acinetobacter baumannii. So the main cause of the ventilator associated pneumonia and the septicemia in the immunocompromised patient is due to the Acinetobacter baumannii. So whenever there can be the MCQs stating that there is ventilator associated pneumonia and the septicemia and the patient is immunocompromised. The most common organism for this disease to happen is Acinetobacter baumannii. Now let us discuss about Bordetella pertussis. The Bordetella pertussis is gram-negative aerobic coccobacillus. The various bioluminescence factors of the Bordetella pertussis are pertussis toxin. So this pertussis toxin disables inhibitory G protein, and the adenylate cyclase toxin is also one of the virulence factor. The adenylate cyclase toxin increases the amount of the cyclic AMP and the various pathological features can be seen. And tracheal cytotoxin is one of the virulence factors of the Bordetella pertussis. There are mainly 3 clinical stages if the pertussis happens. So those three clinical stages are, first of all it is catarrhal stage, then another it is paroxysmal state, and last it is convalescence stage. So the catarrhal stage is characterized by the low grade fever and coryza. The paroxysmal stage is characterized by the paroxysms of the intense cough followed by the inspiratory hoofing type of cough. So, and also there is post-tussive vomiting. So the hoofing cough is caused by the Bordetella pertussis, but the hoofing cough we see is in the paroxysmal stage. Now let us discuss about convalescent stage. Convalescent stage we see the gradual recovery of the chronic cough. The Bordetella pertussis is prevented by the TDAP and DTAP vaccine. If you want to know more detail about TDAP and DTAP vaccine, then you can refer to the vaccine chapter. So what should we do if there is infection with Bordetella pertussis? We give macrolides like azithromycin or erythromycin is the drugs of choice for the Bordetella pertussis. If the person is allergic to the macrolides, like for with the azithromycin, then we can give the trimethoprim and sulfamethoxazole. Now let us discuss about the Brucella. So the Brucella is the gram-negative aerobic coccobacillus, and the transmission is caused by the contaminated animal products. The contaminated animal products can be anything. If the animal is suffering from the Brucella, and if we drink the milk, unpasteurized milk of that animal or cow or buffalo, then we can get the Brucella. Also the urine and the feces excreted by the infected animal, if we get contact with those type of animals, then we can get Brucella infection. So Brucella infection causes the non-caseating granuloma. You should know that one of the important MCQs. So one of the causes of the non-caseatic granuloma is Brucella infection. So how the patient present with the Brucella infection? There is undulant fever, there is night sweat, and there is arthralgia. What is the treatment for the Brucella? We give the doxycycline along with rifampin, or we can give the streptomycin. So this is the treatment for the Brucella. So again, at last I am going to summarize what we have read today. We mainly discuss about the 4 gram-negative organisms. Those are Hemophilus Influenzae, Acinetobacter baumannii, Bordetella pertussis, and Brucella. In Hemophilus Influenzae, you have to know main is it causes the epiglottitis, and in endoscopic appearance of the epiglottis is cherry red, and there is thumb sign in the lateral X-ray. And for their growth, they need the factor 5 and factor X. And Acinetobacter baumannii, it causes the ventilator associated pneumonia and septicemia in immunocompromised patient. And in the Bordetella pertussis, it causes whooping cough in the paroxysmal stage. You have to know there are 3 clinical stages: catarrhal, paroxysmal, and convalescent. In the paroxysmal stage, there is the presence of whooping cough. And at last we talked about the Brucella. Brucella, you have to know that it is transmitted by the contaminated animal product, and the presentation is undulant fever, night sweat, and arthralgia. I hope you understood these 4 topics of the various gram-negative organisms. Thank you.